The American Occupational Therapy Association defines occupational therapy as helping people across the lifespan participate in the things they want and need to do through the therapeutic use of everyday activities.
As an occupational therapist, I focus on all aspects of a person, including their physical abilities, cognitive functioning, and even their environment. Because the scope of our practice is so extensive, it can be difficult for healthcare practitioners to know all that we do. We work in a variety of settings with clients across the lifespan.
I am an occupational therapist in an acute rehabilitation hospital. My sessions primarily focus on enabling an individual to complete his daily occupations, such as activities of daily living, like self-care and home management. I address elements of motor and cognitive performance, including memory, attention, balance, and motor control. I often co-treat with physical therapists to maximize the achievement of client goals, including independence in activities of daily living and functional mobility.
As a physical therapist, I often co-treated with occupational therapists, but never fully understood their scope of practice. When treating patients with difficulties in speaking and swallowing, I assumed referring to a speech therapist would be best. But after learning more about what impairments occupational therapists treat, I realized it would be more appropriate to refer these patients for an OT consult.
I'm an occupational therapist who works with ergonomics and work hardening, which focuses on transitioning back to work following an injury. I help individuals complete job tasks using technology and simulated work tasks, as well as educating clients in safe work practices. I can also evaluate and recommend modifications to job tasks or work areas and even cars to ensure client safety and efficiency.
As an occupational therapist who works primarily with assistive technology, I help individuals across the lifespan with communicating and engaging in all areas of life. You may see me in a school helping children who are nonverbal to speak using an application on an iPad. I recently adapted a laptop for an older adult with visual deficits by adjusting the font size and allowing her to use voice recognition technology to type an email to her grandchildren.
I'm an occupational therapist who works with children. I primarily focus on assessing a child's ability to interpret sensory information to reduce stress and inappropriate or disorganized behavior. A session with me would help a child to better engage in the classroom and school routines, such as riding the bus, playing on the playground, or making friends. I also work closely with the family to support the child's sensory needs in the home and provide support for caregivers.
I am an occupational therapist who works in mental health, where I focus on helping clients to develop the skills and obtain the supports necessary for independent and productive living. We use group therapy to support improved quality of life and decrease hospitalizations through education regarding social skills, stress management, and assertiveness.
As individuals age, there are many aspects of their lives that change. I'm an occupational therapist who works with older adults using a variety of methods to preserve independence in their later years. I often make suggestions on home modifications, such as improving lighting or installing shower chairs to ensure safety. I also provide education on fall prevention and consult with caregivers.
As you can see, the field of occupational therapy encompasses many aspects of rehabilitation. As the profession continues to grow, it is likely you will encounter an OT as a healthcare professional. With a better understanding of the role of an occupational therapist in various settings, it will better enable you to provide the best possible care for your clients.